One thing I would like to articulate is the fact that women living with HIV have suffered a lot of injustices. And one is the forced and coerced sterilization that affecting their sexual reproductive health and rights. That families and clinicians made decisions to sterilize women just because they're HIV positive. And that's an issue we took to court to be able to break that barrier. Two, women suffer as well from the cultures that we have. When a woman is pregnant and she gets her baby, sometimes a woman does not want to breastfeed because of fear of passing on HIV infection. But then now you have to be able to disclose your status to people. The other component is about APNS, assisted partner notification. When women go to facility, when they are pregnant, there's a facility where I went, and that was in Tana River, and women were being sent away to go and bring their husbands. So this woman has burnt charcoal, she has crossed the river, she's come all the way to the facility, then she's being turned away. And this man maybe is a beach boy in Mombasa. So this woman cannot even have access to him. So the service that she was supposed to get, she doesn't get because she's being used as a bait to bring the man now to come into the facility for testing.
As TB affected communities, we've been seeing several challenges both for our TB patients and those that are recovering from TB, such as a stigma from healthcare workers and society, and also some of them have been in prison because of having TB, and others have been having challenges with access to treatment.
So I represent the key populations of Kenya, and I would like to highlight some of the challenges that we as the key populations go through. And we start with first, there is the criminalization part that it is the biggest that fuels stigma and discrimination, violence, extortion, and so many other issues that the key populations are going through. And with these challenges, as the key population, mostly we are being left out behind in some of the interventions that are being designed for community-led interventions. This is because of the criminalization, the stigma and discrimination. Again, if we look at the HIV prevalence in the country, key population are leading in the HIV prevalence. That means that we need to have a focus that is community-led to allow us be able to implement interventions and programs that are designed for communities without the intermediaries.
It's really an opportunity for us to look at what are the gains that we've made over the years, but also critical conversations around health financing and the impact that that has for us to achieve our health rights, because we know we need the money to be put in by our national governments and our county governments, and that money will translate to our access to healthcare. So I believe that this conference is going to enable us strengthen our voices around conversations on health financing so that we actualize what we want to achieve in universal healthcare.
So far right now we are raising the issues up so that we can be able to put them in a policy brief. We know that we have quite a number of laws. So what we are going to be putting in the policy brief, one is to be able to make sure that to ask the government to implement the laws that we have that then can now protect the women. The implementation of the laws that we have, to be able to look at the gaps that are there so that they can be able to be addressed. To also have the government not to use the laws like the Children Act to criminalize women living with HIV, not to use the Sexual Offences Act to criminalize women living with HIV. Those are acts that can be used, but they are not supposed to be targeted towards women living with HIV. This is a public health issue, it is not a criminal issue.
And I'm glad and would like to appreciate Global Fund through Kenya Red Cross for organizing this Human Rights and Gender Conference. We as TB affected communities have been facing several challenges when it comes to human rights violation, but this is an opportunity for us to share out and also inform policies that will improve service provision for both TB, HIV as well as malaria affected communities. So it's a timely conference, being that now is the time that we are seeing a lot of violation, but with empowered communities. And we really appreciate Kenya Red Cross for offering this opportunity for communities to come and have a place where they can share out experience, and also bringing the government in the space to ensure that they are hearing from the communities, us who have been affected, us who have been violated, and we are able to inform programming and ensure that we have policies that are now have good environment for communities to implement intervention on the ground.
One of the things that young people do not get access to is access to health services that are free from discrimination. And that is something that I would want to see change coming out from this conference that we are having. Another thing is that we as young people want to be included in all decision-making spaces that affect our lives, so that we are able to actually lead the responses in regards to HIV prevention, HIV treatment, and any other thing around HIV, TB, and malaria led responses.
And one of the challenges we have been experiencing is access of legal services, especially on human rights, on treatment of HIV, TB, and also malaria. But having come here, you are able to address and know what is other legal fraternities are doing towards accessibility to such services. This conference has opened up a lot of windows and networks that we can collaborate with. And I want to specifically thank Red Cross and Global Fund for being able to organize such an activity. We are able to network and connect with other human rights defenders to address the challenges that we have. Most of our challenges range around labor issues, human rights violation, lack of access to treatment, and these challenges we are able now to address in a legal platform.
So the outcomes of the Human Rights and Gender Conference for 2025 have been amazing. The communities have framed their priorities and identified 5 specific intervention areas. One is that they want their capacity strengthening in terms of their role as community paralegals, as legal aid responders, to be able to deliver services better, and they've made demands in terms of what kind of support they need on that. They've also prioritized the issue of really making actionable steps towards reforming laws and practices and policies that are either discriminatory or unfair towards different populations that inhibit us from fully achieving the outcomes of HIV, TB, and malaria interventions. Communities have prioritized CLM as a tool and want to strengthen the use of CLM in terms of monitoring and accountability for human rights and gender violations. Communities have also prioritized and identified a big gap in terms of their involvement in budgetary review, their involvement in advocacy around financing, and this is a key agenda. And finally, communities have prioritized the need to integrate and measure to what extent we are integrating persons with disability. So this conference has been a really big platform in terms of taking the human rights and gender conversation forward, and hopefully at the next conference we'll be able to measure to what extent have we been able to achieve on our priorities and be able to strengthen what we are doing with the resources we have to address human rights and gender.
We want to recommit that we stand with the communities. We want to recommit that we will work with the communities. We might not have sufficient and adequate resources, both technically and financially, but we are urging you to keep on supporting us and to keep on, pointing out areas where we need to improve, because it's only that way that we can make progress. Together, ladies and gentlemen, we can overcome the challenges posed by anti-rights and anti-gender movements, protect and promote human rights, and ensure that every individual, regardless of their circumstances, can achieve their right to health.
As Kenya Red Cross, we are proud to host this Human Rights and Gender Conference. This is through the support of the Global Fund grant. We are giving communities a platform to jointly with other stakeholders to address and break down human rights barriers that hinder access to full spectrum of HIV, TB, and malaria services, so that at the end of the day, communities feel empowered, they are appreciated, and they enjoy services in a space that is free of stigma and discrimination.